Sam, you've done such a great job. Please come up and say a couple of words. Thank you.
Thank you, Mr. Vice President, Mr. President. So just a few weeks ago, we stood here and asked the American healthcare system to delay elective surgeries and procedures. And the reason why we did this is we wanted to make sure that the healthcare system could deal with any surges. We wanted to preserve equipment, make sure that they had the appropriate workforce to handle any surge. And our healthcare system did a fantastic job. They very quickly stood up telehealth services, and under the President's leadership, we started paying for these services under the Medicare program. But the reality is not everything can be addressed by telehealth. There may be a woman that needs surgery for breast cancer, somebody who has cataracts in their eyes that need to be able to see better, and sometimes a doctor just needs to be able to listen to their patient's heart. We've heard across the country that doctors' offices have closed and many healthcare systems are furloughing their staff, nurses and doctors. Under the President's leadership, we've put out over $90 billion in accelerated payments under the Medicare program, provided $30 billion of grants with more dollars on the way. But thanks to the American people, we are in a much different place. You heard from the Vice President that there are many places around the country where they're seeing a decline in cases, and hospitals are reporting that they have unused capacity. And so as part of our Opening Up America, we are issuing guidelines today about how we can reopen the healthcare system. So these are recommendations around phase one. Now, every state and local official has to assess the situation on the ground. They need to make sure that they can still address surges. They need to make sure that they have adequate supplies and a plan for conserving supplies. They need to be able to screen patients and healthcare workers for COVID virus. And they need to make sure that patients feel safe when they come in to seek healthcare services by assuring that they have the appropriate cleaning in place and that they observe social distancing inside the healthcare facilities. And this isn't going to be like a light switch. It's more like a sunrise where it's going to be a gradual process. And healthcare officials across the country and healthcare systems need to decide what services should be made available. And ultimately, doctors and patients need to make decisions about their healthcare services. And we want to make sure that systems are reopening so that they can stay open and doing that in a very measured way. And I want to thank all the healthcare workers on the front lines who have done a fantastic job in providing care and comfort, serving as a liaison between family members. They've done a fantastic job, and we owe a debt of gratitude to them. And to all those providers that did adhere to our guidelines. They did the right thing, and it has made an extraordinary difference. I also want to take a couple of seconds here to talk about our nursing homes. Our hearts and minds are with the patients and the families of those living in nursing homes. This is an extraordinarily difficult situation. People living in nursing homes are of the most vulnerable patients. They're elderly. Many of them have underlying health conditions. And this has been a very hard situation. I really appreciate the strong efforts of governors and local communities that have shown great leadership in supporting nursing homes across the country, particularly Governor Baker, Governor Hogan, that have had special efforts around supporting nursing homes. FEMA is also working on a plan to make sure that nursing homes have the supplies that they need. And just last week, we increased the reimbursement in the Medicare program for high throughput tests. And we are also paying for labs to go out to nursing homes to collect samples. And that's going to really support efforts on nursing homes in order to isolate patients. Today, we are also announcing, under the President's leadership, an effort around nursing home transparency. It's important that patients and their families have the information that they need, and they need to understand what's going on in the nursing home. And so today, we are announcing that we are requiring nursing homes to report to patients and their families if there are cases of COVID virus inside the nursing home. We are also requiring nursing homes to report directly to the CDC when they have cases of COVID virus. And this is very important, as you've heard Dr. Birx talk about. As we reopen the United States, our surveillance effort around the COVID virus will also begin in nursing homes. And so by having this reporting system, this will support CDC's efforts to have surveillance around the country and to support efforts around contact tracing so that we can mitigate the spread of the virus in those communities that show spread starting in the nursing homes. So again, I want to thank all of the local officials that have done an amazing job in supporting the nursing homes, and would urge all state and local leaders to follow their lead and do everything that we can to keep nursing home residents safe. Thank you.
Thank you very much. And Dr. Hahn is here if you need, he'll tell you maybe a little bit later if you want this, but I can tell you that very simply, the level at which they're approving things, tests, and being on top of the people that are doing the testing for therapies and for vaccines they've never seen anything like this. So I want to thank you very much, and stick around, maybe they'll have some questions, okay? Please, go ahead. In the back.
Mr. President, thank you very much. There are groups of people planning to protest tomorrow against the government shutdown. What would be your advice?
Against the shutdown?
That they want the shutdown lifted. Should they be if it's a state where there haven't been 14 days?
People feel that way. You're allowed to protest. I mean, they feel that way. I watched the protest, and they were all 6 feet apart. I mean, it was a very orderly group of people. But you know, some have gone too far. Some governors have gone too far. Some of the things that happened are maybe not so appropriate. And I think in the end, it's not going to matter because we're starting to open up our states. And I think they're going to open up very well. We're going to be watching it. We're going to be watching it very closely. We're working with them on testing. We're working with them on whatever they need. I don't think they need ventilators anymore. I believe the term the governor used was phenomenal. We've done a phenomenal job. That was the term that was the only sentence they left out, which is okay. But I appreciate that that's what Governor Cuomo said. But these people have done a phenomenal job. As far as protesters, you know, I see protesters for all sorts of things, and I'm with everybody. Please, in the back, go ahead. In the back. Go ahead. You ready?
Yes, please. Thank you, Mr. President. Jen Pellegrino. And yesterday you pointed out that Iran was likely not truthful in the reporting of the virus. Meanwhile, Senator Dianne Feinstein and other Democrats are looking for $5 billion in aid to Iran. Are you considering giving any aid to Iran?
If Iran needed aid on this, I would be willing to do something if they want it, if they ask for it. I would be certainly willing. They were hit very hard. Obviously, those numbers weren't correct numbers that they reported. But if they needed help, if they needed aid, if they needed ventilators, we have thousands of ventilators currently on hand, and ventilators under construction, that are under construction. That's a mosquito. I don't like mosquitoes. I don't like mosquitoes at all. But if they, we would certainly be willing to help. What they should do is be smart and make a deal. It's only because of, you look at what happened. It's John Kerry, I guess, just doesn't want them to make a deal. And they're probably figuring they can wait. And maybe it will be Biden, and they'll own America if Biden gets. And they know with me, it doesn't work that way. It doesn't work that way. If Joe Biden got in, they'd own America. Between them, China, Japan, Mexico, Canada, they'd own America. You wouldn't have a country left if he got in. Go ahead, please.
Mr. President, first question, you mentioned that you've seen some governors, I think you said this yesterday too, that some governors you think have gone too far. Which governors are you referring to, sir? Which states?
I don't want to mention them specifically, but obviously one we can mention that's this, but really much beyond this is Virginia with what they've done on guns. He is playing with your Second Amendment. We can't allow that to happen, and that is indirectly related to this because you know what's happened with guns. People are buying guns at a level that you haven't seen before because of this surge of plague. So what he did was totally inappropriate. Other than that, I'm not going to mention governors, but I have a list: 1, 2, 3, 4, 5, 6, 7.
On money, sir, you mentioned off the top that you hope that a deal may come tomorrow on the small business loan
I
program.
hope so.
But, this morning Mnuchin seemed like this was ready to go. It seemed like any second now. Is there any change there?
Every time you say it's ready to go, then they say, oh, we have a good negotiating position now because he just said it's ready to go. So now let's see what happens. But we want to take care of our workers. We want to take care of our small businesses. They're really the engine of this country. We have to take, when we open, we want to have those small businesses ready to go. We don't want those businesses abandoned because they couldn't afford their employees. They couldn't take care. And I want to take care of those employees.
What's the whole ambassador?
I can't tell you that. I can just tell you that we're negotiating with the Democrats, and they negotiate for things that we can't do, that we don't think are in the best interest of the people of this country. We are very close to a deal. I can't tell you whether or not we're going to get the deal or not. Who would say that? You want me to say we're going to have a deal before we have a deal? We have a good chance of getting a deal. A lot of good discussions were had today. We have a good chance of getting the deal. We want the deal. We want to take care of our workers. We want to take care of our small companies. Go ahead, please.
Thank you, Mr. President. I have a question for you and also for Dr. Hahn, if I may, after I answer your question. In your remarks that you made just a few moments ago, in regards to reopening the U.S. economy, you said, I want it to be safe. And that's a sentiment obviously shared by tens of millions of Americans.
I want it to be safe.
And it seems at odds, Mr. President, with the tweet that you had on Friday about liberating those 3 particular states, Virginia, Minnesota, and Michigan, because none of those states, Mr. President, have met the requirements that the Vice President and others on the task force have talked about in terms of reopening the economy. Do you see those two?
Well, if you take Michigan, there were things in the Michigan that I don't think they were necessary or appropriate. Everyone knows that. I think the governor of Michigan, we're getting along very well, but I think the governor of Michigan probably knows that. I think she probably wished she didn't put some of them in. You can't buy paint, you can't buy seeds, where did this stuff come from? No. We're going to be safe. We have to be safe. And we don't want to close anything. We're not going to be closing. But we're going to be doing it beautifully, systematically. We're working very well with the governors. I would say pretty much almost all of them. A couple of them, no matter what you do, you'll never satisfy them. You could find the cure tomorrow and they wouldn't be satisfied. They'd find a reason to complain. Wise guys. But for the most part, we're working very well with the governors. We have a great relationship with the governors. I can tell you, I've been on numerous calls with governors, and during those calls, without exception, they were friendly. That's going back even a month from today. So I think that we're going to do a terrific job. I think the governors are going to do a terrific job, and we're starting to open our country. And, as you know, I just spoke with Greg Abbott today from Texas. He's fantastic. He's a fantastic governor. And he's going to be opening up parts of Texas. And you're going to be opening up parts of other countries. You know what other states. And you know what that is. And by the way, other countries are at a point where they're starting. I see where Germany's starting to open up little sections. So there are a lot of great things happening. And we're going to start to open our country. And we're going to do it. It's like, as I say, it's like a beautiful puzzle. The state might even be a portion of a state. There are states, very big states. And you can have portions of states, Mike. You have a portion, you have a county, which is perfect, and you have another county that's sort of still pretty far away, even if it's within the same state, and it's not doing so well. But they may open up parts. So we're going to do it very, very carefully, and I think it's going to be very successful. But when you say safe, I want it to be very safe.
Thank you very much.
Let him just do this one. Go ahead, please.
Thank you very much, Dr. Hahn.
Doctor.
There's a question that I don't know the answer to, and I was hoping that you could provide an answer to. There's an epidemiologist at the University of Alabama in Birmingham who's actually a COVID-19 survivor, and his name is Michael Sagg. And his question is this: why would the virus suddenly be different? And why would people's susceptibility be any different on May the 1st, or on June the 1st, or on July the 1st? And this all relates to reopening the economy. Can you explain or give an answer to that particular question?
I don't think we have evidence that one would be more susceptible or less. What I think we can say is that the mitigation efforts have really helped with respect to this. And that what we've seen is the number of cases have gone down. And if we follow the gating criteria for the opening, we're then able to institute phase 1 and have the appropriate measures in place to actually reduce any chance of flare-up of the cases.
Is there a chance of a sort of rebounding if you reopen too soon without the type of mitigation efforts that we've had still in place?
Yes, there's a chance. And I think Dr. Fauci and Dr. Birx talked about this at the podium. And the key here is the surveillance that is being put in place with the CDC. I think that'll be a really great help in terms of trying to reduce that risk. Thank you.
And I think they have the rest of that clip. I just thought it was a very good clip. I think it's a tribute to New York. I think it's a tribute to the federal government. And I thought it was nice. So I think they have that now. They can try it. Go ahead.
We saved everyone, no. But have we lost anyone because we didn't have a bed, or we didn't have a ventilator, or we didn't have healthcare staff? No. The people we lost are the people we couldn't save. Not for lack of trying and not for lack of doing everything that we could do as a society, not only as a government, but as a healthcare system.
Okay.
Your call on me.
Yes, I did.
I appreciate it. Since you shared with us something else that you saw on TV today, I have a question about something you said on Thursday, which is that you were angry because information about the virus should have been told to us earlier and a lot sooner. People knew it was happening and people did not want to talk about it. Many Americans are saying the exact same thing about you, that you should have warned them the virus was spreading like wildfire through the month of February instead of holding rallies with thousands of people. Why did you wait so long
Who are you
to
with?
warn them?
Who are you with?
And why did you
Yeah.
not have social distancing until March 16th?
Who are you with?
I'm Lee Jia Jiang with CBS News.
So if you look at what I did in terms of cutting off or banning China from coming in,
China's national. But by the way, not Americans who are also
nice and
coming
easy,
from China.
nice and easy, just relax. We cut it off. People were amazed. These gentlemen, everybody was amazed that I did it. We had 21 people in a room. Everybody was against it but me. Dr. Fauci said, had I not done that, perhaps tens of thousands, and maybe much more than that, people would have died. I was very early, very, very early. And we just saw, you saw Bret Baier making a statement. They had a debate well into February. And not even mentioned, it wasn't even mentioned, the Democrats. We were very early. Oh, I'm the president. And you know what I just did? And you know what I just...
And by the way, when you issued the ban, the virus was already here.
Okay, and you know how many people, when I issued the ban, how many cases of virus were in the United States when I issued the ban? Do you know the number?
There was...
No, how many cases? Remember I said one person. How many cases were here when I issued the ban? Tell
Did
me.
you know?
No, you have to do your research.
Pandemic?
How many...
I did my research. On the 23rd of March, you said you knew this was going to be a pandemic.
Can I tell you what? I did know it. I did know it. All I have to do is look. Anybody knew it. Just, are you ready? How many cases were in the United States when I did my ban? How many people had died in the United States?
So do you acknowledge that you didn't think
Keep your
it
voice
was
down,
a
please.
spread?
Keep your voice down.
Did you not?
How many cases were in the United States? I did a ban where I'm closing up the entire country. How many people died?
And that's a fair point.
How many people died in the United States? And yet I closed up the country, and I believe there were no deaths, 0 deaths at the time I closed up the country. Nobody was there. And you should say thank you very much for good judgment. Go ahead, please.
You just mentioned Germany. Germany is allowing small stores to open
Yes, they are.
tomorrow.
I just spoke to you.
Does this give you confidence that some European countries are on the mend of recovery?
Well, I hope so. I mean, we hope it works out. Look,
Will you lift some
I spoke with
restrictions?
Angela. I spoke with Angela, and they're going to start a process of opening, very much like we are. We are too. I spoke with numerous governors. They're doing it also. Areas that have been where number one, they've done a good job, and where they don't have much of a problem. Germany's starting the process also, yes, and I'm very happy about that. Some places in Europe, as you know, can't start the process for a while. Yes, ma'am. Go ahead, please.
Mr. President, I have 2 Nevada questions. First one, the mayor of Las Vegas thinks it's total insanity for business to be shut down in Nevada, which the governor Sisolak ordered. Who's right?
Well, they shut one of my hotels down too. Okay, so I'm not involved in that. I could be if I wanted to. I just chose not to be. By the way, just so you know, I could be if I wanted to, but I chose not. But they closed a very big hotel that I have in Nevada, down in Las Vegas. It's a very severe step he took. I'm okay with it. But you could call that one either way. I know the mayor's very upset with it. Some owners are very upset with it. Some of the developers out there are very upset. Others, they say, "Hey, we got to get rid of it." I can see both sides of that.
With one other question. I asked you recently about an SBA rule that said that paycheck protection money could not go to small casinos. You said you'd look into it, and clearly something happened.
They are looking into it right now because they do have, they have small casinos that don't have too many people, and they are looking, and they're going to make a ruling, I understand, next week.
They already did make a ruling, and they changed it from small casinos that make more than a third of their income couldn't qualify to
I know,
half.
but they're looking at that. They're continuing to look at that. It's a big topic because a lot of people involved. Let's give it a shot.
Governor Cuomo, as you played in that clip, has indeed praised a lot of what the federal government has done, but
Excuse me. He didn't say a lot. He said we did a phenomenal job. He didn't say a lot. He didn't say you did a good job on ventilators, but nothing else. No, he said we did a phenomenal job. So report accurately, because you are one of the most inaccurate reporters. Go ahead.
what he has said is that, and along with a bunch of Republican governors who've said what they need, though, is a national strategy when it comes to testing. Because on supplies, they say that they're competing against one another.
They said the same thing with ventilators, and now we have so many that we're going to be able to send them and help other countries that are in need. We're doing great on testing, and we are actually using the Act, as you know, on a certain company.
But what about on the reagents? They say that that's something that they can't
We're in great shape. It's so easy to get. That reagents and swabs are so easy to get. When you have to build a very expensive piece of machinery controlled by computers, that's a different thing. And no, we'll have everything's going to be in very good shape very soon. We're going to be in very good shape very soon. Yeah, please go ahead.
Just the latest stimulus package, will that have funding for states and local governments?
Well, I don't want to comment on it, but we will be saving that for another time.
Will you be willing to?
And by the way, some states and local governments need it. I'm the first one to admit that. We're going to be saving that for another little bit of a later date. Will probably be our next negotiation.
Okay.
But they do. I'm in favor of it, I will say. And I told the Republicans today. I think a great talk with Republican senators today, and all of them. I think just about all of them, and conference call. And we are going to be. That'll be a very big topic over the next couple of weeks. It's very important.
And what is the administration doing to make sure that the hotel chains and hedge funds?
Well, that's another one. Yeah, that's another one. You have hotels that are big, massive buildings that are under-levered, but if you have no income at all coming out, no income at all, these hotels they go from under-levered to they have to be closed down. It's a terrible thing. I don't know that they're working on that specific problem, but it's a problem they should be talking about. I mean, you have people that own a hotel where they go from having a very successful hotel with, many employees, thousands of people, to all of a sudden closing it down. I read where my wonderful place in Florida, in Miami, Doral, they had to let a lot of the employees go because it's essentially closed. You can't use it. You can't have the restaurants. You can't have it. So, you have to close it down. That's an example. Many hotels are closing down throughout the country, and hopefully they're going to be able to open up relatively quickly.
More specifically for small businesses, would the administration?
Well, it depends how the hotel is considered. Is it owned by a big chain? But even if it's owned by a big chain, that's devastating. If they have 200 hotels in the country and they're closed, and it's not only in the country. Remember this. This is all over the world. If they could have 2,000 hotels that are in other countries. They're also closing. We're in better shape than most when you think about it. So I think we're going to be looking at it. I think it's a very big problem. And it's a lot of people employed. Yeah, here we go.
Mr. President, more than 22 million Americans are currently unemployed as a result of this. Today we hit the grim milestone of more than 40,000 Americans now having died from the coronavirus. Can you explain then why you come out here and you are reading clips and showing clips of praise for you and for your administration? Is this really the time for self-congratulations?
Well, I will tell you this. What I'm doing is I'm standing up for the men and women that have done such an incredible job. Not for me, for the men and women, admirals, vice president, if I might, but all of the men and women, thousands, tens of thousands of them that built hospitals in New York and New Jersey and all over this country in record time, to throw up 1,000 beds in 4 days. I'm sticking up for those people. Those people have been incredible. I'm also sticking up for doctors and nurses and military doctors and nurses.
And what you read earlier was praising you and your
All I
administration
played today was Governor Cuomo
to do that, sir.
saying very positive things about the job the federal government has done.
On the
And
day
those
when
people,
40,000
and
Americans
those,
now die.
and those people have been just absolutely excoriated by some of the fake news, like you. You're CNN, you're fake news. And let me just tell you, they were excoriated by people like you that don't know any better because you don't have the brains you were born with. You should be praising the people that have done a good job, not doing what you do. Even that question. So just so you understand, if we didn't do a job,
Why now? Not why are you
I'll
doing
tell
it?
you why now. Are you ready? Because these people are right now in hospitals. It's dangerous. It's going to a battlefield. And I want these people, I want you, I want you and it's all about that. It's not about me. Nothing's about me. And look, you're never going to treat me fairly, many of you. And I understand that. I don't even know. I got here with the worst, most unfair press treatment, they say, in the history of the United States for a president. They did say Abraham Lincoln had very bad treatment too. Let me just tell you.
It has your name in it. It talks about Trump remaking the playbook.
Well, that's a positive thing because that's an exercise in how to do it and what to do. And that's good for the future. People can learn from that. But I want the men and women of this country that are in danger, the admirals and the generals that have done a job like they've never done before. They're in war. We're in war. You know, I call it the invisible enemy. That's a war. And it's a dangerous war. We're also at a level when you said 40,000 people, and you're right, almost 40,000 people. And what, how, more than, okay, good, correct me.
41,000.
Good. Well, I'm really glad you corrected me. But here's the story. Let me just say something. If we didn't do what we did, the 40,000 right now could be 1 million people. Could be 1 million people, not 40,000. It could be 1 million. We're tracking at much less than the lowest possible estimate. And that's a great tribute to a number of people and a number of things. One of the things that it's a tribute to is what's taken place in this country with the American people. Because they've gone inside, they've done it. They've done a job that nobody thought was possible. And in fact, when they did the models, as they call them, nobody thought it was possible. They did models not based on this kind of success. I've seen New York streets, and I see it in the morning. I've watched all my life New York streets, and you can't even see the pavement. There's so many people. And you take a look this morning, you take a look, even on Friday morning, I looked at it, I saw it through a camera. There wasn't a person on Fifth Avenue, there wasn't a person on Madison Avenue. I've never seen anything like it because people have really listened to instructions and they've listened to what we've had to say, and the professionals, they've listened. And those people should really give them a lot of credit, including people like you, because you just don't have the sense to understand what's going on. All right. Yeah, please, go ahead.
Thank you, Mr. President. Should publicly traded companies like Shake Shack and Quantum Corp and Ruth's Chris, should they have access to the PPP program?
Well, it would depend. It would depend. A lot of those, I don't know much about any of those companies, but a lot of times they're owned by franchisees where they own one or two places, and you know they are small businesses. So a lot of that would depend on what the formula is. But again, many of those companies are, you know, they're out to franchisees. A franchisee could open up one of the places that you mentioned. And so, yeah, I would say that's important. Actually, that's like a restaurant. Go ahead, please.
You know, these you referred to these protests earlier. You know, some of them are getting pretty intense, and we're actually getting some death threats to some governors who are reluctant.
You are in the media?
No, the governors are getting death threats. You know, governors of Kentucky, Michigan, Virginia, they're getting increased levels of death threats. And are you concerned that you're talking about liberation and the Second Amendment and all this stuff? Are you inciting violence among a few people?
I've seen the people. I've seen interviews of the people. These are great people. Look, they want to get, they call cabin fever. You've heard the term? They've got cabin fever. They want to get back. They want their life back. Their life was taken away from them. And, you know, they learned a lot during this period. They learned to do things differently than they have in the past. And, you know, they'll do it hopefully until the virus has passed. And when the virus passes, I hope we're going to be sitting next to each other in baseball games, football games, basketball games, ice hockey games. I hope we're going to be sitting next to each other. I hope you have golf. The Masters is going to have 100,000 people, not 25 people watching at the course.
I mean, something.
I am not. No, I'm not. I think these people are. I've never seen so many American flags. I mean, I'm seeing the same thing that you're seeing. I don't see it any differently. They're who?
Nazi.
Well, that I totally would say no way. But I didn't see that. I see all, of course, I'm sure the news plays that up. I've seen American flags all over the place. I have never seen so many American flags at a rally as I have at the Israelis. These people love our country. They want to get back to work. Please go ahead.
Talking more about targeting Paul Manafort or Roger Stone so they're not exposed to coronavirus in jail.
Well, I just tell you this. Roger Stone was treated very unfairly. Paul Manafort, the Black Book, turned out to be a fraud. We learned that out during the various last number of weeks and months. They had a Black Book that came out of Ukraine, turned out to be a fraud. Turned out to be a fraud. They convicted a man, turned out to be a fraud. General Flynn was a highly respected person, and it turned out to be a scam on him. The FBI said he didn't lie. And Mueller's people wanted him to go to jail. Okay? So what am I going to do? You'll find out what I'm going to do. I'm not going to say what I'm going to do. But I will tell you, the whole thing turned out to be a scam. And it turned out to be a disgrace to our country. And it was a takedown of a duly elected president. And these people suffered greatly. General Flynn, I mean, what they did to him. And even the FBI said, and they had some, and nobody bigger fan of the FBI than me at the level of the people that really matter. But the top of the FBI was scum. And what they did to General Flynn, and you know it, and everybody knows it, was a disgrace. He was in the service for over 30 years. He ends up being a general and respected. Respected. And almost his first day in office, they come in with papers they want to investigate him. Never happened before. And now the tables are turned. Investigate the investigators, I guess. These were crooked people. These are bad people. These are very dangerous people. You know what they are, though? They're scum. They're human scum. All right, do you want to have one in the back, please?
Mr. President, the CDC has finally admitted to profound failures with testing kits from the beginning of the outbreak. Is this a function of lax oversight from the Obama-Biden administration?
Well, it's not from me. I mean, they came in and they had some problems early on, but we've straightened it out. But yeah, look, I told you we inherited a lot of garbage. We took, they had tests that were no good. They had, all the stuff was no good. It came from somewhere, so whoever came up with it. But I'm proud to tell you that now we went from having a lot of bad things happening in CDC to having great things happening. They're doing a very good job now. But no, initially, look, our stockpiles were empty. We had horrible stockpiles. We had horrible ventilators. We had very few of them, too. And so did the states have very few of them. But all of these things are now we're at a level that we've never been. Same with our military. Our military is the strongest it's ever been. We spent $1.5 trillion on our military. We've totally rebuilt our military. It's never been in a position. We even have Space Force. Mike and I were talking about what an achievement that is. First time in 72 years we have a new force. So, yeah, CDC had obsolete tests, old tests, broken tests, and a mess. But they've done a very good job. And they've done it under pressure. The pressure is, you know, they had to do this under pressure. So we're very proud of the job they've done. Please, go ahead.
Mr. President, you said swabs are easy, and this has been something that hospitals in the States have been saying there are shortages for more than a month now. Why wait to use the Defense Production Act until now?
Well, we already have millions coming in. We have one company that we're forced to use it with, and probably by tomorrow we won't be. You know, it's a tremendous hammer. Probably by tomorrow it won't be, but we have millions of them coming in. They're very easy. By comparison, and in all fairness, governors could get them themselves. They really could. All of this, but we're going to do it. We're going to work with the governors, and if they can't do it, we're going to do it. If they do it, we can do it maybe cheaper, better. We're getting very high quality. With us, it's all quality too. Even if it takes a little bit longer, we want the highest quality in all of it, including the ventilators. So yeah, we have millions of them coming in very soon, and many of them already have been ordered, and the governors don't know quite where they are, but they'll be finding them fairly soon.
On President Xi, you now talk about the missteps that China made early on in this crisis and how it put the United States.
Well, based on an investigation, we're going to find out. Yeah.
So when you repeatedly praised Xi in January and February, you said he will solve the problem. You said he was doing a great job. Were you duped by President Xi?
No. I made a deal that's phenomenal for the United States. No, you know who was duped? You and the Obama administration were duped for years because China was ripping off this country like in the history of any country. Nobody's been ripped off like the United States by China and many other countries, and we stop it. And we've done a deal where they're paying us $250. They are buying $250. They didn't do anything for us. You know, we didn't even have a deal. It was so bad.
The deal. These comments.
No. It is about a deal, because the deal started a long time ago before anybody heard about this. The deal was finished a number of months ago. Very happy. I was very happy. I hope they were happy. Billions of dollars came in tariffs. Billions of dollars. They're going to be purchasing billions. And then all of a sudden, long after that, I find out about this. And I told you, I'm not, listen, CNN. I told you I'm not happy about it. And this was after the deal. So we have this wonderful deal. And I was nobody's been tougher before the deal ever on China than Trump. Then I made a deal. I was very happy with the deal. It's a great deal, great for our farmers. The farmers have been paid a fortune already. Then what happened? No mistake, we made a great deal. Now I find out after the deal, I find out that I'm not happy. You people are so pathetic at CNN. Let me just tell you, sure, I was very happy with the deal, very happy with everything. Then we find out about the plague, right? The plague. And since we found out about that, I'm not happy. But I closed it up long before Pelosi. Listen, long before Pelosi, you know, she was having parties in San Francisco. Let's all go to Chinatown. And that was a long time after I closed up the country. Go ahead, please.
The first of the month is next week.
That's why your ratings are so bad, because you're pathetic. Go ahead, let's go.
You're close.
Your ratings are terrible. You got to get back to real news. Go ahead.
The first of the month is next week. So for people that are worried about whether or not they're going to see a stimulus check again next month, will there be another stimulus check?
Well, we're looking at it. We're talking about it. It's the delivery's been very good, as you know. People are getting them and they're happy. It's saving lives. We will let you know when it's appropriate, but we're not going to let our people suffer. And you've seen that. By the way, you've seen that better than anyone. And you people have actually covered it okay. But you've seen what's going on. And we got those checks out to people. It saved their lives. Nobody else could have done it. Nobody else could have done it. And I'm very happy if we get this new check out to the workers in these small, essentially to the workers in these small businesses, the PPP, we're going to be very happy, because as we open, those businesses are going to open along with us. Yeah, go ahead, please.
Mr. President, as you start reopening the country, do you plan to coordinate with Mexico and Canada to ensure that U.S. manufacturers
I can see that, too. We're coordinating right now with both. I spoke with President of Mexico yesterday. I spoke with Prime Minister of Canada a lot, Justin. And we're in very good coordination right now.
The supply chain, as companies here.
Yeah, we're doing the supply chain. It's not going to affect trade. That's part of trade, and it's not going to affect trade. And if it does, I will tell you, if a supply chain based in Mexico or Canada interrupts with our making a big product and an important product, or even a military product, we're not going to be happy. Let me tell you that. Go ahead, one or two more. Go ahead in the back. You didn't go.
Thank you very much.
Who are you with?
I'm with the Salt Lake Tribune.
Okay.
Thank you, sir. On Thursday, the White House announced a congressional task force on reopening America. It included every Republican senator but Mitt Romney.
Yeah.
Does that show that you're still holding a grudge against?
Yeah, I'm not a fan of Mitt Romney. No, I had 52 Republican senators.
He was the governor. You don't want his advice.
Well, I just don't think, I'm not a fan of Mitt Romney. I don't really want his advice. Go ahead, please.
Mr. President, why on that task force did you include Senator Kelly Loeffler? There's some questions about whether she...
Because she's the senator from a great state, a state that I love, Georgia.
Trading.
Well, I don't know. I really don't know about that. But she's a senator from Georgia, and she was included in the list. Absolutely. Sorry, a couple more. Go ahead, please.
Yeah, Mr. President, you said you'd spoken to Angela Merkel and the approach being made in Germany. You spoke about
many of the leaders, yeah.
Yeah, many of the countries that maybe have taken their eye off the ball and let coronavirus let rip in their countries. Which one were you talking about? The UK?
You mean some of the ones that didn't do well? I don't want to say that, but you just have to look. And some of them just got hit hard. When I closed up our border, when I did the ban on China, they say a lot of the people that didn't come in here went to Italy. You've heard that. That's why Italy was hit so hard. I don't think it was because of government. I will say Italy is locked down probably more than any other country right now. It's just absolutely locked solid down. But they got hit very hard because people that were coming to the United States couldn't come because I closed the country in January, and they went to Italy, they say. It had to do with trade. It had to do with the purchase of certain materials, and Italy was another alternative. And so many, many people went to Italy instead of coming here, and Italy has suffered greatly. Now, I spoke with the Prime Minister a lot. He's a great friend of mine, and what's happened to Italy is very, very tough. Thank you all very much. We appreciate it. We'll see you tomorrow. Thank you.
All right. A sometimes combative, mostly buoyant President Trump briefing the country along with members of his coronavirus task force. The president says, all in all, things seem to be going well. There are plenty of ventilators available. Medical supplies are coming online. And his administration and members of the coronavirus task force in particular, the president says, have done a good job of answering what he refers to as the plague. We want to show you the 22 states that are going to begin reopening in phase one as America gets back to work. Chiefly the states